Together we achieve victory over heart failure.
Hello, Assalamu alaikum. I'm Dr. Hakim Irfan Showkat. I am Director and Interventional Cardiologist at Srinagar Med City Heart Institute, which is in Kashmir. And we are delving into a silent epidemic that India is combating. We all know that's heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. So let us break down the 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? So people get a diagnosis of heart failure and they think it is something very risky and they think it is the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling and a blood as efficiently as it should. The ejection fraction, which is diagnosed on echocardiography, measures how well your heart pumps blood. So normally the ejection fraction should be around 50 to 70%, and in heart failure, it usually is reduced, what we call heart failure with reduced ejection fraction, or it can be even the heart failure with normal ejection fraction. So why are so many Indians affected by heart failure? There are many risk factors. Genetics plays a significant role, and Indians have genetically more vulnerable to cardiovascular diseases. Furthermore, the other risk factors like diabetes, hypertension, obesity, smoking habits, they worsen this epidemic. So moving on, what are the signs and symptoms of heart failure? The first symptom that heart failure leads to is shortness of breath. And other symptoms can be confusion, fatigue, heart palpitations, nausea, or even generalized weakness. And there is also loss of appetite or even vomiting sometimes. So how can we protect ourselves from this disease? So our hearts work incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor. Early detection of heart failure through regular blood tests, dietary adjustments to maintain the heart health, incorporating daily exercise into your routine, then practicing stress management techniques, quitting alcohol, tobacco, smoking, or any drug addiction. Lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. We have devices like biventricular pacemaker, ICDs, and heart valve repair or replacement. And a last resort treatment option is even heart transplant. So the lifetime risk chronic heart failure or congestive heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Heart failure is very common, be it elderly, young, or males or females, very common in our country. So we have to take care of this disease. Early diagnosis, proper treatment, and proper management is the key for successfully managing heart failure. Thank you.